Today is September the 15th. This is Miss Lynette Campbell. She's going to tell you what she's going to be demonstrating.
Okay, today I'm going to be demonstrating providing denture care. It's really not a whole lot to it, but I'm just going to demonstrate it anyway because a lot of people get kind of grossed out about the dentures. But as anything else, you're going to wear gloves. The person, if the patient cannot take out their teeth by themselves, then you would put on gloves and you would reach in the back of their mouth and pull down a little bit and break that seal and that suction from the roof of the mouth. And the same thing from the bottom. You would go to the back of their jaw and lift up. Obviously, there's precautions if this patient is maybe upset or something because of the risk of being bit. But you could also, in a case like that, go ahead and try to brush their teeth with their dentures in, but it doesn't clean them as well. So all we're doing now is, all you're going to do is just supposed to run a little bit of water in the sink, and it needs to be tepid. Tepid means lukewarm. It's not hot, it's not cold. You're also going to put a towel in the sink in case you drop the dentures, because they will crack and break, and you're looking at a considerable amount of money to fix them. So all we're going to do is we have a top and a lower plate. Over here we have partials, and all that means is that the partial fits in the patient's, looks like the patient's, looks like it was the bottom partial, and that means the patient has all of these teeth, but they didn't have these. So partial is what it is partial. In other words, it just replaces what they don't have. And a lot of times it's for holding position in the jaw as the patient loses teeth. So that's a partial, and you would clean them the same way. They need to stay in tepid water as well when they're not in the person's mouth. Okay, if the patient was in the hospital, they would have their own cup, and it would be labeled with the patient's information, just like the everything else. They would have their name on their cup with the lid. Okay? So all we're going to do is you're going to get a little bit of toothpaste, and then you're going to hold the teeth like this in your hand where you have control, and you're just going to brush them just like you would yours. You're just going to brush up and down, little circles just like you would yours. Okay. Be very careful, flip them over. You want to get the inside of the teeth and the roof of the mouth, which this will be here. That'll be the top of the palate there, just like you would your mouth, except you're holding it in your hand. All right, we'll flip it back over, and you're going to clean right here. Make sure you get it real good. They have denture brushes, which are a little firmer, a little bit bigger, and cover more ground. And then you're just going to rinse. Again, just like you would do your own. Alright. Then you're going to lay them over to dry. Then you're going to do the other one, the next one. And do the bottom the same way. You're going to hold them. You've got a good grip on them. You can see I'm holding my hand like a cup. If I was to drop them, like I said, there I've got the towel there to catch them. Make sure you brush the gum line as well. All right, now you would brush the patient's teeth or gums. Their teeth is here, obviously, but you would brush their gums. You'd brush on the outside of the gums, the inner gums, the palate, any place you'd brush yours while the teeth are out, and refresh their mouth and clean just like you would. All right. Then, if the patient wants their teeth back in, if they use adhesive, some patients do and some don't, you'd put the adhesive on there for them, just like, and usually the adhesive has like a picture on the little tube, and then you would hold the teeth like this, and then being moist, they go in easier. The book tells you to do the top first, And you hold them like this and just slide them in and back up to the roof of the mouth. Same thing with this one. You can hold it right here, slip it back in their mouth. You can hold them right here as well, and then push them down on their gums. And then they can tell you if they fit good or not, if they're in there right. Most people can do that. If they can't, then if it's somebody that's not verbal or not able to explain, then you can feel and see if they move. All right. If they was not putting them back in right now, then they would be put in their cup and labeled, usually overnight is how most people do it. And but they need to sit in a little bit of water to keep them moist when they're not in their mouth, or like a Denture care, some kind of little tablet or something that will clean them overnight as well, kind of soak them. So then, as always, you always clean up after yourself. You put the patient's toothbrush back in their little container. You put the lid back on there. Make sure that everything's labeled, that everybody's stuff that belongs to them. And they would stay at the patient's bedside. Caution, do not make sure the patient's teeth, when a lot of times they eat, they take them out. And you got to watch like the trays, like the dinner, breakfast, lunch trays. You have to watch their sheets. When you're changing their bed and things, you need to be aware that their teeth are in their mouth or in these cups at all times so that they don't get thrown away by accident. Okay, because if they come into the hospital with them, then when it gets time to go home, somebody's going to be looking for them. So that needs to be a daily check for you, is that you check and see if their teeth is either in their mouth or in their cup, so that they've not been thrown away. All right, you can, that skill is skill 19.3, so that means it's chapter 19, and again, it was providing denture care. All right, there's that one.
Yeah, I'm confused on what to push.
Just push that and make it stop.